What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosi. I'm joined by my friend and co-host Keone Tita. Keone, how are you today?
I'm doing great. Thank you, everybody, for listening to us once again. Today, we have a podcast on psoriasis. And the reason why we wanted to do this one is because, for one, I've been seeing a lot of people with it. And conventionally, they say there's not a whole lot that you can do besides symptom management. And so they don't, there's no known cure. But I think with the naturopathic um, treatments that we're going to talk about today, as well as with some of the conventional stuff, you can get a remission or get it to a place where it's not, you know, um, just making your life absolutely miserable. So I guess a lot of people are probably asking, like, well, all right, well, first of all, what is it? And one of the things about it is that it is like most disorders, especially the one we talked about last week, but most of them, it's a systemic inflammatory disorder, and it manifests itself in the skin mostly. And basically, what it looks like, it's like these one type, the most common type, are these large skin patches that can be in really just about any location of your skin, and it's reddish, and it has kind of this silvery whitish dusting or flaking that comes from the dead skin cells that are at the top. But it has these big red patches of skin that can be really irritating and itchy and painful, and it's related to a lot of other diseases, or if you have it, you're at more risk for some of these other diseases. So we'll talk about that. So it's considered an autoimmune type condition, but it's basically the interaction of the immune cells and the skin cells, and the metabolic messengers or cytokines that are going back and forth between them. It's part of an inflammatory cascade, and it seems to present itself primarily at the skin. But as you can tell from what I just said, this inflammatory cascade is actually going on throughout your whole body. Mm-hmm. So this gives you an idea of why you may be more at risk for some other things also. So it's skin lesions that manifest itself on the skin and causes the skin cells to multiply too rapidly. And so you get this buildup layers of skin. And then part of that, with this inflammatory cascade, it causes your skin to create new blood vessels. So hence you see these red patches. The redness comes from these new blood vessels called angiogenesis. And it's like, these plaques that are reddish. And because it's building up skin, you get shedding of skin cells. So it also you see this like white flakiness, silvery flakiness of the dead skins that shed to the top. So it's just uncontrolled skin growth is really what's going on there. And it's made worse by this angiogenesis. There's a number of types. The most common is the plaque psoriasis, which I've been talking about. And that's just the plaques that we were talking about that can present itself. Typically, there's more common places, like it'll show up on your elbows, around your knees, could show up on your torso. It can show up in your skin folds, sometimes, a lot of times on your scalp. And it also depends on what kind of psoriasis we're dealing with. Most common type is plaque. Another type is called goutte psoriasis, which just means drop. It's drop-shaped lesions that form instead of these large plaques. You can also get a puscular form of it also, and it's just uninfected pus blisters that form. And then you can get what's called inverse psoriasis, which is kind of psoriasis that locates itself in the armpits and groin area under the breasts. And I'm going through these types, but you can get a mix of these also. And then you can also get this erythrodermic psoriasis, which usually can come from some type of trauma to the skin, right? So it can happen from maybe a reaction to sunburn or medications or that type of thing. So that's kind of how it presents itself. Mm-hmm. One of the things about, and you may have seen this, Brian, I think, I'm sure you've seen this, but you probably have had some patients come in with psoriatic arthritis. Well, these where they just have these arthritic joints. Well, it's actually psoriatic arthritis, and it's due to the psoriasis. People with psoriasis, up to 30% of them can get this inflammatory joint disease, also called psoriatic arthritis.
Right.
And it's just part of this inflammatory cascade that kind of like parks itself in the joints, and you get this destruction of the joints that needs to be taken care of. Otherwise, it just gets worse and worse. The inflammatory cascade is really important because it is happening throughout the body. And so what you see is a very strong link between psoriasis and other chronic diseases, especially cardiovascular disease. So people with psoriasis, it's very important to kind of follow them and look at not just, look at the skin and try to make that better, but look at the body as a whole from a systemic point of view. And make sure you're running blood lipid panels, see what their risk factors are. One of the things I'll do is I will run some of the inflammatory tests that we talked about on previous podcasts, the homocysteine C-reactive protein. Homocysteine is actually, that one is actually related to folate, and what they found in some studies is that folate may help psoriasis also. And it's interesting because folate can help bring down homocysteine, that inflammatory marker.
Yeah.
So what are the causes? I mean, well, the simple answer is nobody really knows, but as you can guess, genetics does play a strong role in it. I talked briefly just a minute ago, hit on injury. Like sometimes your skin will respond to injury by causing psoriasis. So significant skin trauma, abrasions, sunburns, allergic reactions, other rashes may cause it. There's some link to infections, especially strep throat, streptococcal infections may be there. Also, if your immune system is weak, so for example, immunodeficiency virus like HIV, you may get psoriasis there. So it's good to kind of look and rule these things out. Medications can also be a cause. It's interesting. Weather is also a trigger. In some patients where they'll see that their psoriasis gets worse in like cold, dry air, and then then it improves during spring. That may be a result of as long as you don't get too much sunlight. Sunlight can be a natural treatment for psoriasis, as long as you're not getting burned. A big thing that we've talked about numerous times is obesity. Being obese is a very inflammatory state. Get a lot of inflammation, you will be more prone to psoriasis, especially if that's your weak link in your body. So obesity is a big risk factor. And of course, smoking and alcohol abuse. One of the things I've seen with my psoriasis patients is not only the physical trauma or the physical stress that we talked about. So, you could think about like if you're abusing alcohol, it's more like a physical stress. Not getting a lot of sleep is more like a physical stress, that type of thing. Being obese is a physical stress, but mental emotional stress also seems to play a big role in that too. And I want to bring this up as an aside because I think me and you both, we briefly talked about homeopathy on here, and I'm not a big believer in homeopathy as far as like it being able to cure disease outside of its wonderful use as a placebo, right? So, and what I mean by that, whenever you have like a mental emotional component, a very heavy mental emotional component to disease or illness, this is where homeopathy can really be of help, especially you as a doctor prescribing it, and as a patient also being willing to take it and believe in it. It does have a pretty good placebo effect. Now, I'm not talking about it curing psoriasis, but I have seen homeopathy where you give the homeopathy to somebody and they seem to go into remission, or the psoriasis gets much, much better. And so it may have a mental emotional component with that. I bring that up because I do use homeopathy for that reason alone, and it can play a role here, and we know that there's a big stress component to it.
Yeah.
Um, there's, we talked about inflammatory cascade. The inflammation increases risk of all kinds of diseases: cardiovascular disease, diabetes, high blood pressure, abnormal lipids. There's a correlation with liver issues, NASH, non-alcoholic fatty liver disease, bowel disease, uh, and then even cancer to some extent. So I guess one of the biggest issues with it is, especially if you have it really severe, and it's really problematic from a mental emotional component. I mean, it's your skin, it's what you're showing to the world, especially if it's on your neck or face or scalp or anything like that. So there can be a lot of stress around that, and talk about destroying quality of life.
Right.
That's a big deal. So this is where I think conventional medicine can really help by kind of suppressing the symptoms and then looking for more natural ways to help put it kind of into remission. What else? I think those are the main things I wanted to say. I guess like other components to it. I mean, you can see, like, for some people, you can see changes in the nail beds, where there's thickening or discoloration or pitting of the nail beds, separation of the nail beds. This doesn't mean that that you necessarily have psoriasis, but this can show up. I mean, you could see other things like muscle weakness, inflammation of the eye, the lesions being really itchy. Um, what else? Gosh.
That's as far as just symptoms, Keone, because you alluded to a bunch of
Yeah.
natural treatments, different natural interventions, but just in general, and also
Yeah.
things people can do on their day to day.
Uh-huh.
Getting more sunlight, being hydrated. Like, what's your like first step to just kind of like the, what do we call it? Our bottom tier here, or our covering your baseline. Your
Mm-hmm.
fundamentals of just, if you have this here, be hydrated. You said sunlight can help. Try and get 20 minutes sunlight a day. Is there other things?
Yeah.
I imagine changing your bedding is kind of important frequently, or with some frequency.
Well, it can be. Yeah, certainly there's an environmental component. One of the things I found with some of my psoriasis patients is they are very uncomfortable at nighttime, and there is an insomnia component to it, and that may be related to melatonin. Some psoriasis patients are very low in melatonin, and this is part of the treatment also. But also sometimes, like, bedding can make things more itchy than what they seem to be.
Mm-hmm.
But I'd say the baseline is for people, like, from a natural perspective, would be to make sure that your diet is on point and make sure you're well hydrated. And the other thing that also helps are a number of topicals where you want to keep the lesions hydrated. So oily topicals that are oil based can trap water in there and keep the skin hydrated. It's interesting, right? From a Chinese perspective, especially when you see these like reddish lesions on the skin, most of the time you wouldn't put like oil based creams on the skin. But psoriasis seems to be a little bit different, because if it's not psoriasis, sometimes when you put oil-based stuff on there and it traps heat into the skin, it can make things a lot worse. Psoriasis seems to be the opposite of that, where if you put oil-based on there, it kind of keeps the lesions hydrated and kind of helps the symptoms. But you
Okay.
also want to hydrate from within, right? So drinking plenty of water and stuff like that. Another way to hydrate, it's kind of counterintuitive, is making sure you're getting good healthy fats in there. So omega-3 fats are really good taken in orally. Some of the main treatments for like just mild psoriasis, the bottom line treatment conventionally is just topicals, right? So some of them are just topicals that help trap moisture, but some of them are like steroid creams, things like that, that also can keep the lesions down.
Yeah.
Um,
That was exactly what I was looking for because like you alluded, a lot of I see a lot of different like the joint arthritis. The name is
yeah,
escaping me against psoriatic arthritis.
yeah,
It's and I, I run through the baseline, but I forget things like increasing your fats or having a healthy dose of fats.
yeah,
Yeah,
yeah.
those
It can help.
small
I mean,
fundamental things. I know they're not going to make a huge difference, but that's exactly what we record the
yeah.
podcast
Well,
for.
for some they can have a wow factor for sure. But the other thing that the healthy fats do is they're anti-inflammatory, right?
Right,
So they also help that beside, and in addition to help and hydrate skin,
right,
and they help with cell-to-cell communication, right? So they can help optimize a disrupted, dysregulated cytokine messaging system, inflammatory cascade. So it can help quite a bit. From my perspective, just as my primary care training is, you just want to make sure, and it's pretty easy to diagnose. I mean, you don't really need to uh, do a biopsy of the skin. Usually, it's pretty easy to tell that you have um, psoriasis, but there are things that can mimic it, right? So there's a lot of dermatological things that can also mimic psoriasis, like the basic eczema, dermatitis, different types of dermatitis, fungal infections, all kinds of things like that, even like squamous cell carcinoma, um, more what I would call more dire skin stuff. So if you're not sure, you do want to make sure that you get your diagnosis right.
correct. Yeah,
And then for you and also for me, if somebody's complaining about arthritic symptoms and has the psoriasis plaques, or had them in the past, maybe they're in remission now, then of course you're going to suspect psoriatic arthritis, but you also want to rule out things like rheumatoid arthritis, maybe gout, and that type of thing. And so other testing like laboratory tests and x-rays can certainly help with that. But to make the diagnosis, it's pretty easy from a conventional standpoint. I mean, a lot of times the person who has it, they're coming in, they already know they made their own diagnosis, just seeing, you know, going to Dr. Google and seeing what's on the internet and so on and
right,
so forth.
right.
Um,
As far as like modalities, are you using any acupuncture? You heat, no heat? We ice in these areas. We're not touching the lesions with things like that. I know you mentioned
yeah,
some topicals directly on the lesions.
yeah. For me, it's mostly uh, when I see it, it's mostly like naturopathic treatment in conjunction with conventional treatment. And the naturopathic treatment does not typically include acupuncture, although it may include some Chinese herbs that can be helpful for psoriasis. I mean, acupuncture can certainly help the mental emotional component of that. And so you may get some benefit from there, but doing acupuncture to directly help the lesions go away, probably not. Indirectly, yeah, sure, it can certainly be part of your treatment. um, my treatment protocol basically follows what the conventional protocol would be, right? So for mild to moderate psoriasis, you use like topicals. That can be any type of creams. It's usually, from a conventional standpoint, it's corticosteroids. From a naturopathic standpoint, it can be vitamin E cream, it can be a vitamin D cream, it can be uh, gosh, what is it? Fulvic acid cream, which I actually use. Well, I'll talk about that in just a minute. And then also, so that's like the first tier, and then you do systemic medications. This is conventionally. So then they may use medications that where you're taking oral steroids, or you're taking like medications that kind of affect the inflammatory cascade. That's for more severe forms of psoriasis. And then for any form of psoriasis, phototherapy. This is both conventional and naturopathic. We do know sunlight can help with psoriasis, as long as you're not creating more damage, right? So you're not going out and burning your skin. So a lot of times conventionally they will use like therapies, light therapy, using UVA, UVB light, and they'll use topicals that help uh, increase the efficacy of the UVA, UVB light. Um, like Sorelins or something like that. Like these are creams that can help also. So those are the main things. There's a lot of topical conventional products, right? So we talked about steroids. There's vitamin D creams. There's you can use occlusive tapes and dressings. Uh, Keratolytic type agents. This is a very simple one is salicylic acid, but these are things that can kind of like eat up the plaquing, so to speak, and keep it down. Those are all conventional type ways of looking at it. I talked about the UVA, what we call the Sorlin treatment or PUVA therapy, and that's something conventionally you can certainly do. What else? There's a number of them. For me, I feel like, and again, this is my bias. I know it's yours too. I just tell my patients, like, before you even go down that conventional route, it's probably a good idea to kind of hit the naturopathic route first. But
Sure.
and that's what I'll focus on in just a minute. I just want to go through some of the systemic type things that people will use conventionally. And one of them, a lot of these medications, they're just hard on your body. Like a big one is methotrexate. I can't tell you how many times I've seen people on methotrexate to help with their psoriasis and psoriatic arthritis.
Yeah, I just recognize the name.
Retinoids, yeah.
Yeah.
And then retinoids, and vitamin A therapy, but retinoids conventionally from a conventional standpoint are things that can help. Cyclosporine can also help, but these things, like especially cyclosporine, these things significantly suppress your immune system. So when you do that, when you suppress the immune system, you open yourself up to all kinds of infections, and then even increase your risk of cancers also with some of these medications. So one of the things that I use that is a naturopathic treatment, and I use it both systemically and topically, are fulmaric acids. I think I said fulvic acid before, but it's fulmaric acid. And you can use a topical cream or you can use it orally. And so a lot of my patients, I'll put them on those things. And it's pretty neat what these can do. They're much safer than the conventional treatment, and it's been shown to, in a high percentage of patients, to put people like in complete remission. I think greater than 60% in complete remission. After 6 months of being on that type of treatment, and it's much safer than conventional stuff. I mean, this is why I want to bring this up. This is a big reason why we're bringing up this podcast, because there are things naturally that you can do, and you don't have to be,
with it being that effective. And your point just a minute ago about exhausting all those options before moving on to the more conventional treatments, it's a no-brainer when you give me a 60% success rate with a
right.
And
then you can, in a lot of these studies with this fulmaric acid, you even get better results when you combine it with some of the conventional stuff, right? So like a topical vitamin D analog combination may be really helpful, or conventionally, using something like steroids in conjunction with this stuff, with the fulmaric acid, may also give you results. So a lot of times you can treat symptomatically, like with steroids, but you can also kind of treat in a systemic, what I would say, more direct way, with something like fulmaric acid. So just to keep, I want people to, like, before they go to the conventional stuff, like really think about some of the natural stuff. But I think one of the things that just go back to the basics, like you alluded to earlier, and specifically as related to what we know can help psoriasis. Most people with psoriasis, I'll put them on a gluten-free, dairy-free diet if they can do it. If they can't do it, I put them on high-dose enzymes anytime they eat gluten or dairy. So you can break down dairy and gluten, those proteins, to its base amino acids, so your immune system doesn't react to any of that.
Right.
so that's one thing you want to do. There are some studies on the Mediterranean diet and psoriasis that seems to be helpful. It definitely lowers the severity of it, and this may be due to the high amounts of olive oil, right? So think about hydrating from the inside out with olive oil, and the high amounts of fish. Maybe if you get your essential fatty acids through fish, maybe that's one of the reasons why it helps. Again, it's also a great diet for vegetables, colorful fruits and vegetables, and also higher fiber, which can also help feed your gut bugs, right? And your gut bugs, what we also see. I feel like sometimes when we're on these podcasts, I feel like I'm just repeating myself, because especially when it comes to the probiotic aspect of it, right? And prebiotic aspect of it. So high fiber diet, feeding your gut bugs, getting them healthier. Therefore, you get your skin healthier. It's as simple as that. And your skin and your gut are contiguous with one another. They derive from the same embryonic tissue. So you treat your gut, your skin tends to get better also. This is one of the main things that I will do also. If there's weight to be, if you have weight to lose, there's pretty good studies on showing that weight loss helps. There are numerous environmental therapies that I find very interesting. One of them is the sunlight therapy, but there's also another therapy. It's called climatotherapy, and it's just using like the healing capacities of environmental factors, like certain climatic locations, including air temperature, humidity, barometric pressure, and light. And I bring this up because there's some neat studies, epidemiological studies on this type of therapy and soaking in the Dead Sea. And it's really interesting because the low altitude of the Dead Sea, it's like the lowest human inhabited place on Earth. So you're getting lower intensity UV radiation, right? So you're probably not going to damage your skin from being out there. Of course, you don't want to be out there too long, but also it's low pressure. The salts in the Dead Sea seem to be really good for your skin. It's a high mineral content, and it just seems to really help people with psoriasis. So the studies of psoriasis patients undergoing like Dead Sea climatotherapy, it's pretty impressive for a naturopathic treatment.
I wonder if
So
it would be
I
similar
tell
with like
people.
a flotation tank or not. Sounds like it'd be pretty aggravating,
What?
but
No, I think you're right. It would be a form of thing that you could do, especially if you're not going to go to Israel and soak in the Dead Sea, right? Not
that's not an
everybody
option.
can do that. Right. But yeah, I would think so. Like these high flotation tanks that are using a lot of minerals and salts and stuff. Again, it's a form of balneal therapy or bath therapy. Mineral. So those things help. Mud baths seem to help. Mineral water baths seem to help. Moderate heliotherapy, we talked about sun exposure, right? Moderate sun exposure seems to help. One of the biggest things that seems to help, at least symptomatically from a naturopathic perspective, are moisturizers, like using like good creams that can help trap water and moisturize the skin. Moisturizing soaps are great. Anything that promotes skin rehydration. The more you lose a lot of water through your skin, anytime you can help stop that, that's great. What we also know is that sleep hygiene is so important. Go back and listen to our sleep podcast on that. But chronic sleep deprivation significantly ruins your immune system. It impairs skin integrity. It weakens it as a barrier, and it just pours fuel on the fire of psoriasis. One of the things that we find with psoriasis patients is that it seems like there's a correlation between psoriasis and low melatonin. So melatonin levels seem to be significantly lower in psoriasis patients. So I usually put all my psoriasis patients on melatonin and really go over like the sleep hygiene stuff. Most of my psoriasis patients have sleep issues. So I will definitely go over that. Stress management is a huge thing. We already talked about that. But that's a big component of it. And so anything that can help with stress. One of the biggest things I have to remind people, I have to remind myself, also this, as don't take on extra obligations if you can help it, like really think about taking care of yourself before you take care of others. I
Mhm.
mean, you can't take care of others as best as you could unless you take care of yourself. So I'm a big, if we're going to talk about like what is my top supplement go-to thing with that, if they're not doing it, it's going to be fish oil. I don't think people are going to be like take tons of fish oil and be like, wow, my psoriasis is gone, although I've seen it improve that way. But it is one of the things, if it's not there, they need to be on it. People with psoriasis, second tier would be the people that have psoriasis, tend to be very low in vitamin D. I want to make sure those levels are up. And also, since conventionally they'll use vitamin D analog creams, there are vitamin D natural creams that people can use also that seem to be really effective. And then the other cream I like is that fumaric acid cream, which I'll have people get on. And it's a lot of times I'll just have people switch back and forth between like either a vitamin E, vitamin D, or the fumaric acid type cream. They can do it, switch off day and day, every other day, or they can do 1 month one type of cream, next month the other type of cream. Whatever one helps. Those things can be used together. As long as as long as you space them, use one, then use the other.
Mhm.
You can use them sequentially like that. Um, since it's an inflammatory disease, it seems to be an autoimmune disease, inflammatory autoimmune, curcumin, it's my favorite anti-inflammatory. And another natural product that really helps with inflammation is boswellia, or boswellic acid, or frankincense. So taking a combination of curcumin and boswellic acid, or boswellia, can be really helpful also. Another topical that I just want to bring up, it seems kind of counterintuitive, I have seen it help though, and the studies are pretty interesting, is topical capsaicin cream. So you would think, you're putting capsaicin cream on like an angry, like plaque-like reddish lesion, you think it'd sting like heck, and sure enough, it does. But after a while, after the initial application and the initial sting just goes away. It does seem to really help with the itchiness and the overall disease severity. So I'll tell people, that's another option that they could certainly try.
Right.
What else? Oh, this one is interesting, and I don't know why this seems to be so helpful for people. I mean, I have an idea why, but it just seems like for psoriasis, it does seem to be helpful for some, more so than it would be otherwise for other things. So it's whey protein I'm talking about, and we know that whey protein has can really increase glutathione levels in the body, right? Because of sulfur containing amino acids. And we know people with psoriasis have really lower levels of glutathione being your body's main antioxidant. So it seems like whey protein just boosts that up. And, one study, I think it was over like 2 months of just adding whey protein isolate into their diet, they saw significant improvement as compared to like topical and light therapies. So, why not? And it's kind of counterintuitive because I was saying, well, get people off of dairy and gluten,
Mhm.
but whey protein whey protein being a dairy product, it seems to be the exception here. So anyway, I tell people to certainly try to add that in.
Right.
There are other naturopathic treatments that I haven't used myself. I haven't needed to use them, but there are, like, there's an herb out there called Polypodium leucotomas, and that is a Central American herb, South Central American herb that is used for inflammatory skin diseases. and it also seems to be safer. You can use it topically. It seems to be safer than the conventional UVA, UV light therapies where you're using topicals on there. So I'll tell people to think about that also. And then I use another herb sometimes, especially when you're getting like systemic symptoms of the psoriasis, like psoriatic arthritis. I use peony glycosides or the herb peony, and that's part of one of the herbal formulas I use, what peony in it for skin issues. So it's more known as a Chinese herb or used in Chinese medicine more than anything else. But that's pretty much it I wanted to go over for psoriasis. I just want to give people an idea of, you know, how they can help themselves with it. It can really be disconcerting when you have these lesions all over you and you've tried everything and nothing, you know, nothing is helping.
Right.
So
Right. And then with that said, it's crazy just how the little things can make such a big difference too. So it really is just being aware of all these different options and your health in general.
yeah, and I think you're right. Like the thinking about the baseline stuff can really help. I mean, I know, you know, fish oil is kind of like one of those things, like the, you know, what naturopath doesn't throw fish oil at an ailment, you know, or even some conventional doctors. But here with psoriasis, it does really seem to help getting on a good regimen of omega-3 fatty acids. And the nice thing about the natural stuff is you can use it in conjunction with the conventional stuff and you'll get
Right.
better results.
Right. Anything else, Keone?
No, I don't think so. Anyway, thanks for listening again, everybody. I hope that helped.
Yeah. Happy, healthy skin.
Yeah.